It's commonly thought that meniscus tears need to be treated surgically, but is exercise actually a viable treatment option for degenerative meniscus tears? In this video, we'll talk about the long-term results of exercise versus surgery. When looking at meniscus tears, we can generally divide them into two different groups. We can have an acute or degenerative meniscus tear. An acute meniscus tear generally occurs with some sort of trauma, like getting hit at the side of the knee, whereas the degenerative meniscus tear doesn't have a traumatic onset necessarily, but gradually occurs over time. This distinction is important because this study only looked at degenerative meniscus tears, so the results might not apply to acute tears. Also, in addition to traumatic cases, they also excluded those with mechanical symptoms such as locking at the knee, so if we're having any of those symptoms, again, these results might not apply. And what the study found was that for degenerative meniscus tears, exercise performed just as well as surgery over a 5-year period, so it does appear that exercise is a viable treatment option for degenerative meniscus tears. The exercise protocol used in this study was performed twice per week for 8 weeks, so a total of 16 sessions, with each session lasting about 30 minutes. At the beginning of each session, they started with a warm-up on a stationary bike for between 7 to 15 minutes, depending on the person's tolerance. The next exercise was a generalized hip strengthening exercise, with a little bit of balance sprinkled in. And so this exercise was actually only performed on the non-painful leg. So the painful leg was only for balance actually. And so what they did was they took a pulley and then they anchored it around the non-painful ankle. And what they would do is they would go into 3 different planes. They went out to the side, to the front, and then also to the back, each performed for 3 sets of 12 reps. So what they would do is you would balance on that painful leg and then just slowly bring that leg out, trying to stay nice and steady here, so there's no movement on this leg. All the movement is just occurring on that outside leg. And then we'd rotate to work on hip extensions, so now the band is going to be anchored in front of us, and we'll go into that single leg stance, extend the hip back, and then come back to that starting position, again going for 3 sets of 12. And then finally working on some hip flexion, so now the band is going to be anchored behind us, and it's going to be similar to a kicking motion. Again, in that single leg stance, one more time, and then push our leg out in front of us, and then back to that starting position. The exercise protocol also included standing hip extensions for the symptomatic leg. So for all the other exercises that we just did, the weight was actually on the non-symptomatic leg, while the symptomatic leg primarily worked on balance. But for this one, we're going to be working the glutes and the hip extensors on that symptomatic leg. So it's going to look exactly the same. In a single leg stance here, the exercise band is around my symptomatic leg, and then extend the hip back as far as we can go, and then back to that original starting position. Again, for this one, they did 3 sets of 12. For the first 4 weeks, they performed calf raises in a leg press machine. If we don't have access to a leg press machine, then we could do standing calf raises. So we'll start with both feet on the ground, and then just slowly lift our heels up off the ground, and then slowly back down to the ground. For this exercise, they stayed with 3 sets of 12 repetitions. For weeks 5 through 8, what they did was they transitioned to a single leg calf raise. So everything stays the same, but now we're just going to do a single leg calf raise. Again, 3 sets of 12. If we need a little bit of help with balance, then we can use a chair or a wall, just so that we have a little bit of support so we can focus on that heel raise. And then again, for the first 4 weeks, they worked on balance by standing on a wobble board, first starting off with both feet. And then for the last 4 weeks, what they did is they transitioned to a single leg stance on the wobble board, aiming to hold this position for 3 minutes. And then for weeks 1 through 8, they also included single leg presses. So if we have access to a leg press machine, then we can obviously do our 3 sets of 12 there. But if we don't, we still have a couple of different options available to us that we can perform at home. One would be a seated knee extension. So we could take an exercise band placed around the ankles and then slowly extend our knee out and then back to that original starting position, so we're still working the quads. Another option is that we could do some squats. And so we can have our feet separate to whatever feels most comfortable and slowly lower ourselves down towards the ground and then back up. So when we're doing a squat, we're still working the quads and we're getting a little bit of glute activity as well, which is a little bit more similar to that leg press machine. For weeks 5 through 8, they also performed lunges if they are tolerated. And so we can start in this position here and then slowly lower our knee down towards the ground. If we don't change our footing here and just perform several reps, this is actually a split squat. It's a little bit more challenging because we're just doing all the reps in a row on one leg, which makes it a little bit more challenging. If we actually want to do a lunge, then we actually need to add a step in. So for a lunge, we would step, lower the knee, step, lower the knee here. Either one should be okay, as long as for that split squat, we just perform them on both sides. Each session also had some sort of cardio, so they would perform either 10 minutes of stair walking, running, or jumping. And then finally in weeks 5 through 8, they concluded with a cross-trainer for cardiovascular exercise performed for about 10 minutes. And while this is a useful exercise protocol, we probably don't need to follow it exactly to have a good outcome. So if we don't have access to some equipment or some of the exercises are aggravating, we can modify them so we can still load the area and still have that good outcome. So hopefully this video on exercise and surgery for meniscus tears was helpful. If it was, go ahead and give this video a big thumbs up. I'll see you guys in the next video.